Easing lockdowns is like tiptoeing across a high wire. How do you balance the need to reopen businesses with that of preventing a second wave? Well, across Canada, it's a real mix of strategies. New Brunswick was the first province to pull the trigger on lifting some restrictions. That was at the end of April.
Within 10 minutes of the announcement, my phone started ringing.
Now you can go see a dentist in Saskatchewan, get a haircut in Alberta, or eat out in BC.
We missed the dim sum, yeah, for sure.
But sticking to new guidelines is a challenge, to be sure.
All of the compliance things that we need to do now for COVID, plexiglass, 2 meters, the space, 50% capacity, all these things add up to making it very, very difficult.
And for some people, especially those in the harder hit provinces like Quebec and Ontario, it can feel like things are moving too quickly.
I think we're just opening ourselves up a little bit more to the risks.
But what's clear, this High Wire Act has a captive audience of millions, waiting, watching, holding its breath. So from relief to fear to frustration, there are a heck of a lot of emotions tied up with reopening. So joining us to talk about that is psychiatrist Dr. Rima Styra. And once again, we've got infectious diseases specialist Dr. Isaac Bogosh joining us. And Dr. Bogosh, maybe I'll start with you. I mean, clearly how you feel about reopening depends on where you live in this country. But what's your take on the pace of reopening across Canada?
Certainly in some places, I think it's completely appropriate. You've got the eastern provinces, which are having, 0 to 1 new cases per day. It's completely reasonable to start lifting these public health restrictions, but while still being careful. But then you've got places like Ontario and Quebec, which are still having a significant number of new cases per day, primarily focused in and around the Greater Toronto area and in and around Montreal. And, perhaps we might need a patchwork of reopening that enables the safer parts of the provinces to reopen, but might maintain some of the current restrictions in the heavier hit areas.
Right. And Dr. Styra, of course, I mean, when you talk about a province like Ontario where there is a higher caseload, not everyone is comfortable to start shopping at their local bookstore or hop back on an airplane. It's like some of us want normalcy, but aren't quite ready for it yet.
For it, yeah. So I think, one of the big things is that we all have to assess our own individual tolerance of risk. For example, some people might have a higher tolerance of risk, others might be a little bit more vulnerable. And it also depends on what we're comfortable in terms of mitigating factors. So when you start thinking about individuals who might be more vulnerable, for example, people who've already been identified as high risk for COVID-19, based on age, based on medical problems, individuals who might have already had, for example, an anxiety disorder, where they were already trying to deal with anxiety, and now the COVID-19 has actually increased that anxiety. They're going to be more vulnerable and more reticent in terms of progressing forwards.
Dr. Bogosh, something that may have been anxiety-inducing over the weekend, we saw what happened at a park in Toronto. Let's go ahead and show photos. This is Trinity Bellwoods Park. And Dr. Bogosh, we've heard you say that it's safer being outdoors than indoors, but when we're talking that many people, tell me what we can learn from this.
Yeah, these are scenes that clearly we don't want to be having more of moving forward. And of course, we know things are safer outside when we think about transmission of COVID-19, but not when you have thousands and thousands of people clustered together closely like that. That's clearly unacceptable. But, we saw other scenes of that park where, kudos to the people who were out there who were separating themselves by 2 meters, and kudos to the other people in and around the GTA who were also enjoying the nice weather in other parks. And we saw lots of other scenes of people separating by 2 meters. But clearly, it's not acceptable to cluster together like that, especially with thousands of people. Even if you are outside, it's just not acceptable, and there certainly is risk for transmitting the infection in those settings.
And so, Dr. Styra, when people are balancing their COVID fatigue with the risk of getting together with other people again, how do you expect folks will navigate that?
I think they're going to navigate it by basically taking small steps. There's a lot of uncertainty right now still in terms of transmission and how we can protect ourselves. So we always feel comfortable in environments that we're familiar with. It helps us feel that we have a better control of the situation. So I can see people moving forwards meeting in groups in terms of family or close friends. And as they become a little bit more comfortable with that, they're going to expand their reach and start thinking about all the other kinds of things that we want to do. We're a very social creature. We enjoy being with others. We enjoy all kinds of activities, including entertainment, sports activities. So we're going to try and focus on seeing how we can actually mitigate that uncertainty.
Right. And so, Dr. Bogosh, let me give you the last word. Those small steps that we're all thinking about taking forward, the approach to finding that balance between reopening and risk, what's your take?
It's going to be challenging. Obviously, it's not feasible to stay in a lockdown until we have a vaccine. And clearly, it's not acceptable to just reopen the economy like nothing ever happened. And I think that's almost a false narrative that's being portrayed in some circles. There's got to be some middle ground. There's got to be some balance. And if we have the tools in place to rapidly identify cases, support people through 14 days of isolation, do rapid contact tracing, have a good understanding of where these infections are occurring in the community, I think we can safely reopen the economy. But I still think we have to always be prepared in the pre-vaccine era that to manage uncertainty, and there will always be a potential risk that this infection can be brought into any setting. So we have to. We're basically going to be living with risk for the foreseeable future. We just can make it as low risk as possible.
All right, doctors. Thanks so much for your time. Good to talk to you.
No problem.
Thank you very much.